Good afternoon. The topic of the day is the COVID-19 and how we can stay safe, as we know that this has been around for a few months now. And so far, according to Centers for Disease Control and Prevention, there is no treatment. There's no treatment, there's no cure, there's no vaccine available yet. So only thing we can do is boost our immune system and also to stay safe, eat healthy, and follow the guidelines which are put together by CDC, like safe distancing, and use the protective equipment, mask and stay keep the distance. But most of us already know what the COVID-19 is. Just a brief description. This has been so much in the press. Everybody kind of became an expert. So much in the news what this COVID-19 is, and basically the continuation of the coronavirus. And also we're looking at the SARS and MERS, and so basically now we are dealing with the COVID-19 continuation of the same thing, little more potent. How did it start? December 2019, virus came from the seafood or poultry farm, probably in Wuhan, so we know that. So from the China study, we had a lot of information about how it did spread, but also how they were able to control that, which we are using on daily basis to help individuals and to boost our immune system. What does corona mean? Basically is a crown, which we know is around the virus, and that will help to stick easily to the structures. And also when the treatment is available, that actually disinfectants will kill the virus also. So we know that part also. So basically we like to go a little faster through that route, reason being this has been covered by so much in media and other lectures. So we don't want to spend a lot of time. Okay, so this virus does cause more cellular damage, produces more inflammatory cells. So we know that. And the main thing is that it gets stuck to the mucous membrane. And when we know that it goes through the nasal passageway, through throat and the lungs, and that's where we are seeing most of the people get the effect, and into hospitals and the respirators. So we need to also keep in mind that the mucous membrane is not only in the respiratory passageway, but also in the digestive system. And so we need to protect the entire body wherever the mucous membrane is, because many of the studies which we find in the Wuhan, coming from Wuhan, mention that majority of the cases who were positive, who came to hospital, reported that actually the symptoms, early symptoms, started from their digestive tract. So if we keep the digestive tract strong and healthy, and the mucous membrane is intact, then basically the infection can be prevented. But also with that, we need to keep in mind that the first port of entry, even though it's the nasal passageway, but in general, the GI issues are so common, and we keep ignoring them and not pay attention. And only time we get scared is when we have issue with the breathing, or with the heart, or with the brain, three vital organs. So in this case, many individuals who will be infected will not even know or not even pay attention much until the issues are with the breathing. But as soon as you feel there is something wrong with the digestive system, either you have diarrhea or something else, upset stomach, then that's the time you should be paying attention. So COVID-19 at this time actually have been to worldwide, almost every country. We have over 8 million cases worldwide, and more than 437,000 deaths have occurred already. In the United States, we are saying we have over 2.1 million cases already, and the number of deaths are the highest in probably the most advanced country in the world. We have more than 116,000 individuals died. So that actually is really something to be concerned about, how we are handling that. But again, so far there is no treatment available. The similarities between the SARS and COVID, basically we see fever, signs of fever, cough, fatigue, malaise. Again, these both are airborne, may lead to respiratory distress. We know that. And then for any of those, there's no treatment available. Again, difference is basically we have been through this before. You see that in the media all the time. In the symptoms, we're looking at the common symptom will be fever, fatigue, dry cough. Whereas before the studies came from Wuhan also mentioned that these individuals had reported they had issue with their GI, so basically issues start with the gut. Less common nasal congestion, runny nose, sore throat, diarrhea is also there. Symptom may show 5 to 6 days. Basically, these are things. So basically, what our concern is the risk factors. So most of the individuals who were infected and who couldn't make it through the treatment are basically with age, immunological or immunocompromised state, people who have suppressed immune system to begin with. Diabetes, one report says more than 35% of the individuals who died were diabetic. Cardiovascular disease, people who have heart disease, that's also hypertension, pulmonary disease, renal disease, liver disease, malignancies, basically cancers, and severe obesity. So they're basically looking at the number of cases. So in general, if we have any pre-existing condition, that's what makes our body weak to begin with. When our immune system is not strong enough, when our body is weak because of the disease or because of the drugs we have taken or because of our lifestyle, because of the chemicals or toxins in our system, that is what we need to address first. If those are taken care of, then our body have the capability to fight against any organism, could be virus or bacteria or parasites or anything else which enters the body, which basically is fighting against the anything which is causing the infection. So that, keeping that in mind, the first thing we always, like I mentioned before, we like to use precautions. In this case, social distancing has been number one thing, where CDC recommend that we stay 6 feet away from other individuals, and especially not to go to crowded places, especially shopping centers, transportation, and also cover your coughs and sneeze. Basically, the personal protective equipment became very, very important. So the mask is very important. And so if mask is not available, make sure you have something to cover your nose and the mouth. Now there are a lot of fabric, basically mask available, and you can make your own if you like to. And again, with that, we also suggest to use supplements and foods which will boost your immune system. Like I said before, the main goal here is to learn how we can boost our immunity. If our immune system is strong and intact, then basically we can fight off the infection. Also, lifestyle changes, which means basically diet and exercise. Both of these are very important. Light exercise every day or walking, which will improve circulation. And of course, you are what you eat. A good nutritious diet will always be useful. So it goes a long way if you are putting something nutritious, something good, something healthy in your body, and compared to a lot of junk food and things which are not going to support your body anyway. In case there are individuals who are drinking a lot of soda or a lot of, I see some of the places we go for shopping because people are staying home. They'll fill their carts with all these sodas and all the this sugar, high sugar drinks and potato chips, just because they're staying home, having a party every day. But again, all these things are not giving you much of nutrients. So it should be dependent more into smoothies and soups to have better nutrition in this body. Then we also talk about the sportive care, which will be Ahar, Vihar, and Aushadhi. So goal is, like I said before, even though there's no treatment available, we want to make sure our body is strong and able to fight off it so we can stay healthy. So prevention is basically what we're looking for. So when we talk about Ayurvedic medicine, we look at a few things. So this is a definition of the of health in Ayurveda. It says some dosha, samaganisht, samadhatu, malkriya, prasanna atma, indriya, mana, swasth iti abhidhyate, which means when the doshas are balanced, the agni is balanced, and dhatus are balanced, and basically those are very, very important. So doshas, I think we have talked in this library before. Dosha is basically looking at the body type or body constitution. What Ayurveda believes, everything is made of 5 elements: space, air, fire, water, and earth. And combination of these 5 make 3 body types or doshas. So the space and air makes vata dosha or vat, and fire and water makes pitta dosha or pitta, and water and earth makes kapha dosha or kapha. So these 3 doshas are the building blocks of our body. Means the kapha dosha, which is water and earth, gives us the structure. The fire and water, which is the pitta that controls our metabolism, enzymes, hormones, all the chemical reactions happening inside the body. Whereas vata dosha, which with the because of the air quality, that will control all the movement inside and outside the body. So whatever is moving outside and whatever is moving inside the body, which means the cardiovascular system, including the lymphatic system, the gas exchange in the lungs and the cellular level, the filtration in the kidneys, also the movement of food from mouth to anus, which means the digestive system, the motor and sensory pathways in the nervous system. So basically, all the nervous system is controlled. So what we are seeing moving in the body, majority of that is controlled by the vata. So if those are balanced, it means if the movement and absorption of all the foods is proper as this should be, then we have the balanced doshas. Agni is the heat. The most important of these heat is metabolic heat. So which we basically is very important. So temperature is extremely important in our immune system. So when your body temperature drops less than normal, and before that was higher, then you know something is happening in the body and the temperature is going down. So in Ayurveda, we actually refer that with Agni. Each dosha, each dhatu, each step have his own Agni or own temperature, and that temperature is required for the release of enzymes and hormones and to have a balanced or well chemical reaction. So in this case, when the temperature is low, that will create a problem because the Agni is also low. And the dhatu, basically the 7 type of tissues in the body, which means that whatever we consume is going to be converted into next dhatu, which will be the fluid, or the fluid to the blood to the tissues or the muscles, and from muscles to the fat to bone to bone marrow, and then the genetic material. And the extract of all of that actually is called Ojas. And actually the point of discussion is Ojas today, because that is what we call the immune system. And then this definition says, and then malkriya means excretion. So excretion had to be optimum, which means we should have regular bowel movement every day, at least twice a day, no difficulty in urination. So basically, and then prasannatma indriya mana, basically all the sense organs and the internally, your heart and soul feels happy and you are feeling happy, balanced, pleasant, satisfied. All these are conditions which are part of the definition, which makes a person healthy. Anytime there is jealousy, anytime there is anger, frustration, that moves us from healthy state to unhealthy state. So looking at the Ayurvedic point of view, we're looking at the doshas, looking at Agni, and also we're looking at the dhatus. So when we're looking at the dhatus, there are 7 of these dhatus, like I said before, and then each dhatu have its own Agni. So what Ayurveda says, whatever we consume, between dependent upon how strong our Agni is or the metabolic fire is, in 3 to 5 days, the extract of that will become part of the body fluids. Again, dependent upon the Agni of the rasas, in 3 to 5 days, the extract of that is going to nourish the blood. And in 3 to 5 days, extract of the blood, the extract of the blood will nourish the tissues, and the an extract of the tissues will nourish the fat in 3 to 5 days, and from fat to bone, bone to bone marrow to shukravis or the sperm, or then after that, the essence of all of this is going to be ojas. Each dhatu itself also have oja. It means they also have the essence, they have their own immunity, which makes the person strong and able to fight off against any infection or disease. But the ultimate ojas is the essence of all the dhatus, and that depends upon what we have consumed. So to begin with, if you're looking at the rasa dhatu or the fluid, which is coming from the extract of our food, which we have consumed this morning or yesterday, and then based on that, the blood is formed, and based on that, the tissue or the muscles are formed, and based on that, the fat is formed. So since each is depending upon the previous dhatu, so the first one is depending upon what we have consumed. So the balanced diet plays a very important role. But even before that is the digestive system. Whatever we are consuming, whatever we are eating, if it is not absorbed properly, and if there is an inflammation in our gut, then that whatever we, doesn't matter how good our diet is not going to be absorbed properly. So digestive system is of the main importance, prime importance in our metabolism, in our general health, and of course the immune system, which is again very important when it comes to the fighting of against any infection. So when looking at that one, ojas include the endocrine system because all the glands are part of it, the nervous system, the skeletal system, muscular system. So it's basically hepatopoietic system, all the dialysis system, all these systems basically are part of the ojas because it goes through step by step through every part. So in this case, when all these symptoms are performing at optimum level, then the oja will be maintained. If there is any problem in any of these tissues, if a person have a underlying disease, a pre-existing condition, a chronic disease which they have been fighting off against for many years, and taking many drugs, which of course will also suppress the immune system, then the person will have much higher probability and chances to get any infection, whichever comes into their contact. So therefore, ojas is the potential source of strength, power, and resistance against any illness, and we call that natural immunity. And that is one thing we need to keep in mind. How do we do that? That is also very important. So ojas is the essence related to vitality and immunity, fight against aging, decay, and disease, formed during biosynthesis of bodily tissues. All dhatus has the capacity to create its own ojas, and ojas present in a single dhatu or cell is called localized ojas, and collectively, basically, that is called the ojas, a name given to all the essence, pure essence, which comes from all the dhatus, which is very important. So like I said before, when we are dealing with the immune system, we are looking at the ojas, but again, ojas depend upon each dhatu, and then absorption of all the nutrients depends on the digestive tract. When we look at the digestive tract, we look at the health of the digestive tract, and even though we want to make sure the mucous membrane is intact, but also we want to make sure that the gut microbes are also in good shape. So with that, we need to make sure that if someone doesn't have a good digestion, they need to be taking prebiotics or probiotics both. So prebiotics, basically, if you have green, leafy, colorful vegetables, that gives a material in the ground to heal the gut, and then we will have a good growth of bacteria. If we are taking things like sauerkraut or things kefir, or we are taking generally commercial probiotics which are available in the market, or yogurt, for example, will be a good source. So goal is to keep the gut healthy, making sure that the absorption is good, making sure that whatever we consume is easily digestible, making sure our body temperature is good. So after the absorption, we want to make sure that the body heat is there. So even though in general we find 98.6 degrees is normal body temperature, many individuals have 98.2. To anybody who have 98.2 to 98.6 is normal, and there are few who even have lower than that. So if this is your temperature, or this was your temperature at young age when you were in your teens, that is the temperature you want to maintain. So later on, after 10, 15, 20 years, if the temperature has gone down, it means there may be something happening in your body, and you should pay attention to that condition which might have dropped and lowered your temperature. So you want to increase that. If temperature is not coming up, that's where we bring heat from outside by soaking our feet in the hot water every night for 15, 20 minutes, or also consuming food which are warming by nature. For example, soups are really good, or cooked food, or hot food, or sauteed food. Not putting something cold or icy, or not having ice creams, especially after dinners. So that will bring our temperature even lower, and the heat or the metabolic heat will be lowered, which will not be helping us because it will not release all the hormones and enzymes which we need for metabolism, and the food is not going to be absorbed properly. So basically, when we look at that part, we bring it to the diet part, and in diet, which we mentioned before, soups are really, really important. And in most of the soups, you want to add herbs or spices which are warming. And if someone have any underlying or pre-existing condition, you want to add spices to your soup which are going to be healing. So like I said, I mentioned before, the report says 35% of the cases who could not make it or who died were those who had diabetes. So, or people with the hypertension or cardiovascular disease are at higher risk. And again, now the new reports are also coming, which are telling that people who were infected, and even though they are now safe and their test shows negative, but because of the effects of the virus, they have higher probability of developing blood clots. So eventually the risk of cardiovascular disease and stroke is much higher in those individuals. So we want to prevent that also as much as possible. So in your soups, you may want to add things like fenugreek or cinnamon if somebody have issue with the diabetes, or somebody who is hypertensive. They may want to add celery. So basically, you want to add chopped celery, and then you may want to drink or eat the celery soup. So celery is basically a really good for cleansing the blood vessels, and also good for hypertension. So goal is to make the food as your medicine. So in this case, like I said before, you are what you eat. So if we eat a healthy, balanced diet, and that provides us the medicine which we need, and that will keep us healthy comparatively. So first thing is, we always want to make sure we put something hot in this body. Naturally, our body works optimally at a higher temperature. So that's why our temperature is 98.6 on the average. So if you put something cold in this body, it's going to draw heat from us to melt and to be absorbed. And that lower temperature will slow the metabolism down. So why not support the body by adding something warming? So soups come first, and then after the fresh organic food, cooked food. Again, always I mentioned locally grown food. So when we look at the principle of Ayurveda, it says that we are made of the space, air, fire, water, and earth. And those are the things which are nourishing us, which are in this environment where I am breathing, I am drinking water from here, so I'm living in this area. So basically all the plants, vegetables, fruits grown in this area are going to nourish me more because they are made of the same material. So not only those will be much helpful and nourishing, but also in this journey, we want to support our local people, local farmers, local restaurants, and so they are one of us. So we want to make sure we support them. And again, knowing us locally, they will give us a good food, good preparation instead of something coming from a chain store and we don't know where it's coming from. Who cooked it is basically there in the frozen form and warm it up and serve. So better to find local places to provide support us and support them also. So digestive system, like I said before, is of most importance. But vitamin C played a big role in boosting immunity. There have been studies, like I said before, from Wuhan. In Chinese studies, they have used as much as 25 gram of vitamin C through IV. So even though it's a very high dosage, but a naturopathic profession basically scored that and says that if we use 2 to 6 gram in multiple dosage, so basically if you take 2 to 6 gram 3 times a day, that's much better. And this is a water soluble vitamin. So if from some reason body doesn't need them, it'll be basically flushed out through the kidneys as long as the kidneys are in good shape. So the foods, which again is not coming, is basically easily available. Broccoli is very rich in vitamin C. Cauliflower have a lot of vitamin C. Kale have a lot of vitamin C. Sweet potatoes, bell pepper, fresh thyme, mustard, spinach, Brussels sprouts, strawberries. All these have very high vitamin C. And there are a lot of fruits. Basically, we look at the fruits also with vitamin C. All the citrus fruit all basically have a lot of vitamin C. Amla is one fruit which we use in Ayurveda. The main ingredient in Chyawanprash, which is basically an immunity booster. So amla actually have 20 times more vitamin C than orange. So we highly recommend amla for that reason. So goal is to boost the immune system. This have been covered before. Social distancing is very important. We keep the distance. And the non-smoking, basically, people who smoke already have compromised lung. So in that case, when lungs are already weak, and on top of that, we get infection, that creates even more problem. Personal hygiene, of course, is very important. Again, when we are taking care of our body, definitely we are healthier. Ayurveda recommends massages every day. Ayurveda recommends that you go basically have exercise every day, yoga, tai chi. So all these things are very important. So dincharya or daily routine is very important, and we want to make sure that to maintain the circulation in this body, we keep drinking hot water, which is again recommended in the morning. Some individuals take that with some honey and with some lemon juice. Otherwise, just the plain warm water is very beneficial. Drink tea with the cardamom, which helps the lungs. Tulsi, holy basil is also really good for lungs, actually the entire gut. The cinnamon is very important for lungs, but also for individuals, especially who have issue with their sugar metabolism. So all the diabetics, and with that we can also put fenugreek, like I mentioned before. Ginger is really important because it improves circulation. And with these, if you want to put, you can also put ajma seeds and cloves also. Clove is antifungal, also antivirus. So a couple of cloves in your tea. So that tea will be very important so all day, if you boil almost a gallon of water, and if you're at home, every hour, 2 hour, take 1 cup or so. There's no addiction. It doesn't have any chemicals, doesn't have any sugar, and no really caffeine or anything. So it'll be really good to boost the immune system and keep the body warm. And also it helps the absorption also. So take care of your Agni, digestive fire. We talked about this before, making sure our metabolism is optimum. And for that, we always take soup. So raw foods are not recommended in Ayurveda, even though there are a lot of individuals who love to eat raw food. And one thing is, chewing is very important. When we chew the food, you should give every tooth a chance to bite. So if you have 32 teeth in your mouth, make sure you chew 32 times. So chewing is very important. So until it becomes a smooth paste, you should not swallow the food. And again, absolutely nothing cold at all. So that is very, very important. Some of the exercises or yoga, which is part of your daily routine. Pranayama is extremely important because pranayama is the name given to this exercise. Prana means life, ayama means taking in. When you're taking the life force in, it's simply deep breathing. So many individuals who had issue with stretching their lungs, and when they take a deep breath and it hurts, it means there is some infection or there's calcification or there may be fluid. Something is going on, at least will tell you that there is something wrong with your lungs and you should seek help from a healthcare provider. Otherwise, basically 10-15 minutes every morning, every evening, you should take deep breaths. And through the deep breathing, basically, you want to make sure that you're able to stretch your lungs and you're able to absorb all the nutrients. And there are different phases of that, which will not go over, but absolute importance is to take long, deep breath. There are yogas. Again, these are all the asanas, which are very important. So any of these you can do easily. Of course, you do that. Flexibility is very important. As long as we are flexible, as long as we have the capability of stretching, as long as we are able to do this easily without hurting ourselves, is very important that we maintain that. Surya Namaskar actually is of most importance. So basically spending 15 to 20 minutes in the sunlight, morning and evening. So when you are exposed at least 30% of your body or skin for 30 minutes in the sunlight, and early in the morning and in the evening, that is where you absorb a lot of sun rays, and which helps in the conversion of vitamin D. Again, we know that is required for so many things in our body. So basically, again, people living in the northeast always has issue with vitamin D level. So vitamin D is extremely important. We want to make sure we have that. Then we come to the Aushadhi part. The end is more about the herbs. So we know that the inflammation is the big part of the condition. The mucous membrane is inflamed, and because of the inflammatory response, many of the patients have shown that their cytokine storm syndrome also start. And even though these are used for helping us, but again, when the cytokines are going so crazy or overreactive, they kill everything, including the good cells also in the body. And so there are many individuals where it has been seen that the cytokine storm syndrome actually had did a lot of destruction in their body and they caused the death. So we want to make sure that that is also intact. We want to make sure the immune system is also intact. So looking at these herbs, we're looking at amla, which I mentioned before, is the number one herb when it comes to vitamin C and also boosting the immune system. So extract form of that usually available in capsule form. 2 capsules twice a day are very beneficial. Giloy is another extract of giloy fruit. So very useful in the immunity, in the lung health. So that will be again something we will suggest to use people who have who want to prevent themselves. Of course, vitamin C is very useful. We mentioned before, 2 to 6 grams multiple times a day. Vasaplex is a combination, is a decoction, herbal decoction. Main ingredient is herb vasa, really good for lung health and also to maintain the mucous membrane of the air passageway and the lung, and also helps the gas exchange better by reducing inflammation. And same thing with the immunity plex, as the name says, boost the immune system. So both of these have many herbs from Ayurveda which are put together to boost the immune system and also improve the health of the lungs, also the air passageway, and also they help the gut lining. So in Ayurveda, digestive system is of the prime importance because every other organ system is dependent upon the digestive system. As we know, our heart, lungs, kidney, brain don't eat directly. We don't put food in them. So whatever we are consuming and putting in our stomach, And after that, depending upon how healthy our gut is, whatever is absorbed, that will be supplied to rest of the body. So my gut is also responsible how healthy my heart health is, how healthy my brain is, how good my lungs and kidneys and liver and spleen. All these are getting nourishment depending upon what I am absorbing in my gut. So Giloy is important. So basically, immunity plex is important. These two, Vasa and immunity plex, are really good for boosting immune system and also to maintain the gut health. Chyawanprash is a jam which is very popular in Ayurvedic world and Ayurvedic lifestyle. Basically, the main ingredient is amla, which is vitamin C. But with that, there are many potent herbs in small quantity, and this is something which can be used as a bread spread. It can be used as a, you can put in your smoothie. You can eat with the milk. It's tasty, but really a multivitamin in Ayurveda, and also is a immunity booster. So this is also one of the anti-aging herbs Ayurvedic practitioners use, and so recommended 1 to 2 teaspoons every day at least. Ghee actually is recommended in Ayurveda to lubricate the body. Also, ghee have not only good fat, but also butyric acid, which is basically a probiotic, and so really, really important um, to use ghee also. Withania plex, the stress level is very high at this time. So many individuals I talk to every day, all day, is everybody is concerned. Many individuals are concerned because the second wave had started. Many individuals are concerned because if the offices and schools open and we have to go back to work, how that would be. Many are concerned if they will have a job after a few weeks or a few months or not. But stress is everywhere. So Withania is one herb which actually helps not only basically in our own nervous system, but also is an adaptogen. So adaptogen will help us uh, taking care of the situation and help us in the adaptation of the circumstances. If we have stress, it makes us able to handle the stress better. So we won't have a panic attack, we won't have anxiety. So Withania is very important, and also is available uh, in a decoction form, and we recommend 1 tablespoon of that 2 to 3 times a day. Until under the stressful condition, there are individuals who will drink, you know, 5, 6, 7 times a day because it helps them. It calms the nervous system. And there's no overdose. Complex is other combination of herbs where basically helps to calm the nervous system. It is made of Brahmi and ashwagandha. So combination of that also helps as the supporting the nervous system while also boosting immune system. Of course, vitamin C, we mentioned that before. Zinc is also very important. Make 30 milligram twice a day. Is very good dosage. We always start with a small, low dosage. And Xinghao is a Chinese herb which basically Chinese have used that. Again, is also anti-malaria and again had been used in the past for viral infection. They recommend basically 2 to 6 grams a day. So we take 4 capsules 3 times a day in general. So these are there to boost the immune system in case we do need the help externally. But internally, if you are eating a balanced diet with soups and smoothies, juices, so individuals who have hypertension and a history of high blood pressure for a long period of time, of course, you are taking your medication, but celery juice will be very important. And if you want to make a celery and ginger juice, ginger is a good herb for improving circulation, also produces heat, good for metabolism. So you may want to take ½ inch of ginger and 4 to 5 stalk of the celery. That will yield about 1 glass, 8 ounces of juice, and drink that once a day, twice a day. To boost immune system, you may want to add a little bit of amla juice in there in your smoothie. You may want to add, if you like to, basically 1 carrot. Beetroot is important. So beet have magnesium. So when it comes to gut health, the fiber is very important, and for relaxation, magnesium is also important. So in this case, individuals who have history of constipation, and the statistics says that over 70 to 77% of US adult population is constipated. So in that case, we are dependent upon Metamucil or other fibers we take from stores, but why not change our diet to the level where we get enough fiber from our food, which could be, like I said before, green, leafy, colorful vegetables. But beetroot have a lot of fiber, a lot of magnesium. So if you're taking half beetroot every day or twice a day, there won't be any harm. In fact, it will be giving you a lot of benefits. Asparagus is really good to not only for boosting immune system, but also it is helping in the hormones. So during stress level, again, during the hard times we are going through, and the entire country, entire world is facing the problem, not only just problem with the COVID, there are many others which came. So at that point, the hormones go out of balance. Again, hormones are not only going out of balance in females, but also in males. So even though male like to suppress and not to mention it, but in this case, we want to make sure the asparagus is used, which will be helpful. Again, if you have issue with the hormones and also cholesterol and blood pressure, then you may want to again combine the asparagus and the celery and the beetroot. Again, if you have high blood sugar, then you may not want to use the beetroot because of the sugar, and you may want to put either fenugreek leaf in the smoothie or juice, or you may want to put the fenugreek powder or cinnamon powder. So you have to find a combination which will help you boosting your immune system while you are also taking care of the underlying condition or any pre-existing condition. So those had to be, those need to be taken care of. Again, like I said, people who have issue with their gut, you make sure you first take care of your absorption. Doesn't matter what you eat, if your absorption is not optimized, nothing will help because it's not being absorbed. And so that's where we keep bringing up the heat over and over, like soups and easy to absorb food. Smoothies play a huge role. And I always mention that when you make a smoothie, you want to make a balanced smoothie where you may want to use something for liver, you may want to use kale or spinach, you may want to use something for digestive system like papaya, you may want to use something for circulation like half inch of ginger, you may want to add something for inflammation like turmeric powder or turmeric root, and you may want to add something for omegas, flax seed powder or flax oil will be good. Again, you want something for protein, so why not add a little bit of almonds, 5-6 almonds, something for fiber and to change the taste. Dates are really important, really good. They're good for metabolism and basically of a lot of fiber. Again, they're tasty. And then you may want to add 1 cup of warm water or hot water to bring it room temperature. Nothing should be cold and frozen. And just blend it, no ice and no sugar, and use that smoothie. It's very nourishing and nutritious. Smoothie have basically is a medicine. So in general, when we are using different things, goal is to boost the immune system so that we stay healthy. And then even though if we are maybe in an environment where there are people who are sick, at least our immune system is able to fight off against the infection, against the organism, and we stay healthy. Sleep is very important, and so we like to follow the circadian rhythm, where we know that as the sun rises, we should be up, and as the sun sets, we should be planning to basically go home and relax and then sleep. So what Ayurveda says that there are times for Vata, Pitta, and Kapha, which means there are time to improve circulation, there's a time to improve metabolism and repair, there's a time to nourish ourselves. So in that case, the morning 10 a.m. to 2 p.m. is the Pitta time, which is really a good time to eat food which is going to nourish us. That's the time for excuse me, for good metabolism. So you eat your main meal at that point. Whereas same time in the night is the time for repair. So 10 p.m. to 2 a.m. is the time when the Pitta is helping all the repairs which we have which we need. All the damage done as a daily wear and tear of the body will be repaired. So sleeping during the time is extremely important. But I'm finding many individuals who do not even go to bed until 2 o'clock. Just before I started this, when I saw a patient, goes to bed between 3 and 4 a.m. And that is not the time to go to bed. It's time to wake up. So there are some times when he mentioned he can go to bed 2 o'clock, rarely before 12. So point is that we should learn from nature. When everything is going home, even the birds are so smart, they go home, and all the animals are hiding. We should also be going in the bed and going to sleep, and sleep in an environment where there are not electronics which will be interfering with our sleep pattern, and they're not blinking lights, so it should be darkness. So melatonin is produced, and we have a good sound sleep. So that is very important. Sleep is really crucial when it comes to the immune system. So in general, we want 6 to 8 hours of sleep. So Pitta individuals require a little less, Kapha a little more, Vata in between. So we want to make sure that we have a good sleep, but that sleep has to be in a place where we feel safe. And then once we go to bed, we are just there for at least 6 to 7 hours, not broken sleep. If you are waking up in the night to go to the bathroom, that means that we need to be taking care of the kidneys, or prostate in case of men, or hypertension in case of both men or women. So we always look at the symptoms. The body does try to communicate and express what is happening, and we need to learn to listen to the body. If somebody is waking up in the night because of hyperacidity or heartburn, then you pay attention what causes heartburn. You look at your acid built up, and you look at your food, look at if you're smoking, or look at if you are drinking also. So alcohol and smoking will stimulate the lining of the stomach to produce more acid. But again, if you're eating spicy food, then don't eat spicy food, or do not go to bed immediately after eating the dinner. So all these things which will play a role in our immune system are building the immune system. So good sleep, good food, good rest, and making sure all these are used properly, which means if we are eating good food, then we have to have a intact digestive system to absorb all that food, and that is very important. And if that is not happening, then you do take some supplements which are going to help you resolve those issues. So this thing is not over yet. We are talking about COVID. Second wave just started in many cases. In many cities, the cases are going up. In many countries, cases are going up. And so we are dealing with the uncertain issue. And since there's no treatment, prevention is the best thing at this point. And we have known in the history of human race, humankind, that individuals who had a strong immune system, people who were able to take care of their bodies, they survived, and they were healthier, lived longer. So definitely, medicine may or may not work, treatment may or may not work, but your immune system definitely will work if you take care of it. So that being said, I will like to go for some more herbs, and then we'll stop, and then we'll open for the question answers. Some spices which we use every day in Ayurveda: turmeric, like I mentioned before. Golden milk became so popular all around the world is just not because this herb is golden in color, is because this herb can be used everywhere. Is one of the best known antibiotic, antiseptic, antihistamine. So in that case, doesn't matter what happened. If nothing is available, you take that herb, it definitely will help. So somebody have inflammation, take turmeric. If somebody have an injury, put turmeric there. So in that case, we make turmeric milk because turmeric requires either black pepper or bromelain or some fat for absorption, and that's why it goes with the milk. Or if you don't like the regular milk, then you can use the almond milk, or you can just mix with something. But if you're not, sometimes people will tell me I'm just putting in my meat or rice or anything like that. But if there is no fat, if there is no bromelain, if there is no black pepper, turmeric is not going to be absorbed. But turmeric is, like I said, golden herb. Can you be used ajma seed or ajwain seed? is really good in helping the metabolism. So that's why we are using that. Ginger, we have mentioned that before, is a herb which have 5 tastes out of 6 total tastes, and really good for boosting the immune system. So that will be very useful. So basically we need to use that. Garlic is also very useful. Fenugreek is the cinnamon and fenugreek we put together for those individuals which are, like I mentioned before, who are diabetic, and which is a very common condition. Like I mentioned before, 35% of the cases or people who passed away are those who were diabetic. So we have to be very careful in our daily life, where if there is somebody who is basically, say, basically pre-diabetic, which actually term is a newer term, because either you are diabetic or not diabetic. So I want to make sure that we are taking fenugreek or cardamom to make sure your boost system is boosted. Clove is very important for anti-fungal or antiviral. Saffron is boosting the immune system. Thyme is really rich in vitamin C, so that will be really useful to boost the immune system and to stay healthy. So basically, our goal would be use a combination of herb, use a combination of spices, use a combination of your lifestyle to boost your immune system, to maintain your immune system, to stay healthy. And doesn't matter what it takes, you have to boost that. Svedana is basically, when you look at the therapies, we are looking at. So we are looking at the therapies. So Svedana is the therapy in Ayurveda we call the steam therapy. Ozone is used. So in generally, when we look at the Svedana therapy, a person is sitting in a steam cabinet and is sweating with the heat. With that, the ozonizer is pushing ozone inside the cabinet. As the pores open, the ozone is pushed inside. So there are a lot of research being done on these, and found that ozone is really good to kill the viruses, parasites, and bacteria, and even cancer cell. And the heat is also important for the same reason. When we combine both the heat and the steam, it will be very beneficial to take care of the infection. So we'll stop at this point. Anyone who have any question, I'm available here. Again, if there is something which we can discuss, you may want to send me a note. But main goal of the talk was to give the information how to prevent from getting sick. Again, main thing is the social distancing, but again, with that, your immune system will go a long way, not only prevention at this point, but also in the future, because every opportunistic disease, which may be coming from parasite or bacteria or viruses, is coming when we let it come, when we become weak, when we have not taken care of ourselves, or we have not taken good food, or even though we think a balanced diet, but it may not be balanced for our body type, or the heat inside the system is not good enough, or the digestive system is not intact. Thank you very much. And like I said, if you have a question, we'll go over this.